some good news for patients who suffer from severe depression. For the first time in decades, there's a new type of antidepressant, and it's fascinating. The FDA just approved a nasal spray that can relieve symptoms in a matter of hours.
But there is some controversy here. The medication is related to ketamine. That's an anesthetic used in surgery, but also used as an illegal psychedelic party drug known as Special K. So Dr. Mallika Marshall is here tonight. Doctor, what can you tell us about this new drug?
Okay, so it's called esketamine, or Spravato is the brand name, and it's intended for patients who have major depression who have been on at least 2 antidepressants without relief. Now, in trials, people who were on the nasal spray had relief of their depressive symptoms more than people on placebo. Older antidepressants can take sometimes weeks to kick in and start working, but with the spray, some people got relief within a couple of days, so that's really amazing. But because it's a cousin to ketamine, it can cause sedation, problems with attention and judgment, suicidal thoughts, and it does have some abuse potential. So they have put some precautions in place so that it doesn't get misused. You can't do the spray at home. You have to do it in a doctor's office, and you have to be observed for at least 2 hours after it's administered. But, you know, there are people with major depression who are refractory to treatment who become suicidal, and so this drug could save lives.
And the speed with which it works seems to be a new thing.
People were amazed. Some people in the office said, I feel a difference.
And those safeguards seem thorough.
Yes, they do.
Incredible. Doctor, thank you very much. Also tonight, if you like to walk your dog on a leash, be careful. A new study from the University of Pennsylvania says it could increase an older American's risk of fractures.
And this is such a fear for older people, but so many older people love to take their dogs out for a walk. That's their exercise.
I know, and that's what we often recommend. Do you have a dog? Go walk the dog. Yeah. Well, according to a new study, the number of fractures associated with walking a dog on a leash, in particular, in people 65 and older, went up by 164% between 2004 and 2017. The most common fracture was a hip fracture, which we know in older people can be really serious and can be deadly. Also, upper arm fractures and wrist fractures happened more often in women, and in fact, more than a quarter of the people injured had to be hospitalized. So yes, physical activity is really important, but perhaps we should put some more precautions in place for the elderly. Some suggestions were obedience training, so that the dog is not dragging the person down the street or lurching. And then perhaps you should get a smaller dog that's a little bit more easy to control.
Goes on the lap as well.
Lap dog,
Nice.
yes.
Lap dog.
An obedient lap dog is what you need.
Dr. Mallika Marshall, thank you so much.